wait a minute. Where are you going? Where are you going? Wait a minute. Slow down, slow down, slow down.
Well, the doctor's orders say for Mrs. T that she has to get her heparin, so like we should.
But wait a minute. We haven't even gone in to see the patients yet. Why? Tell me what you're thinking.
Well, but we're supposed to check the physician's orders. Like, how often do you do that here? Like, it said in there that was a new one to do. So, and she has to get.
Well,
her
let's take a deep breath. Let's slow down. So let's talk about how are you going to prioritize your care today?
Well, she needs to get heparin. That was a newer order, so we have to go for that. And then we have our other patients in 207 and 6, and we have to get them later, but because they had orders that were already completed, so we have to get to this one first.
So let's slow down. Now, what did you learn in nursing school? What's the first thing you're supposed to do when you come out of report? Now, it hasn't been that long since you've been out of school.
Right, but we're supposed to look at our load and figure out where we need to go, and she
But
has to
wait
get
a minute
heparin.
now. So let's talk about, do you remember assessment? Isn't that the first thing we're supposed to do?
Yes, we're supposed to assess, and that's where, for Mrs. T, like, she's got the orders for the heparin, and we need to look at that. So
tell me why you were going into the med room. I don't understand. Help me understand what you're thinking, what your thought process is.
Okay.
Because I don't understand it right
well,
now.
we had.
You don't even know if your patients are breathing. I mean,
we
that's
just
what I
had
learned in
report on
nursing
them.
school.
They just, no,
Yeah, but you didn't put your
had-
eyes on them. Isn't that what you're supposed to do? What did they
we're
teach you in
supposed to
nursing
get stuff
school?
together and organize that.
I mean, I
And
have the
so-
same problem with my nursing students at school too. Nobody ever wants to take a look at the patients. They want to go right into the skills. What about seeing the patients? You don't even know if they're breathing.
Okay, so when you look at them, you still have to figure out.
So
what
why are
your
you going
orders
into the
are,
med room? I still
because
don't
I need to
understand.
check the heparin. I have the heparin calculation here for her, so we can get that.
Heparin, why are you worried about the heparin? You don't even know if she's alive. If she's dead, you don't even have to give her heparin. You don't even know if she's bleeding out. If she's bleeding out, are you going to give her heparin?
If the physician wrote the order this
So if the
morning,
physician tells you to jump off the bridge, are you going to do that too? What is your responsibility as a nurse? What is the first thing we're supposed to do? What are we responsible for?
We're supposed to advocate for our patients.
Exactly. So how are you going to advocate for your patient if you don't even know what they
But
need?
if I'm not even prepared to do that, how
It
am I
doesn't
gonna
sound
go
like you're
there?
prepared to me. Now, what week are we in orientation? This is the 4th week of orientation. And these
And
are the
when we
same
did this
problems that we're
last week,
having.
You weren't.
I
you didn't
don't
do that.
understand. I just don't understand. I don't understand. How did you get a license? I don't understand.
Forget it.